Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College. So today, I will be performing my return demonstration in assessing the thorax and lungs of a patient. So the first thing that we need to do in this assessment is that we need to verify or we need to review the client's previous medical records and also the doctor's order sheets if available. This procedure will be very beneficial because it will help us to verify the need in performing these assessments. So this will be my improvised doctor sheet, and it shows here that this will be the very first assessments of the patient here in the hospital. So next is that we need to determine the scope of the assessments needed, and also we need to prepare the necessary equipments that we'll be using in this assessments. And completeness and organization of materials will help us to be ensured our efficiency as nurses. So in assessing the thorax and lungs, the following equipments that we will be using will be, of course, the stethoscope here. And next is the tape measure here. And also we will be using donned gloves if necessary, the marker, and also the patient's gown. So after that, now we need to perform a hand washing or a hand hygiene, and this procedure will be very beneficial because it will help us to deter the spread of microorganisms, and also, as I have aforementioned, if necessary, use gloves. So I'm now done in my hand washing, and also we are done verifying the need in performing these assessments. So now we are ready to enter the patient's room, and since we are in the patient's room right now, we can start the procedure and wait for our patients. The introductory phase. So the first thing that we need to do is that we need to greet the client politely and the client's companion if around. And also introduce yourself and verify the client's identity and ask how the client would like to be called during this assessment. And also do not forget to establish rapport with the clients, and the verifying the client's identity ensures that care is being rendered to the correct client. So, sir, good evening. Ako di ay si Kenneth, your student nurse for today. And pwede na ako matanaw yung mga wristband, sir? Salamat. So, can you tell me your full name, sir?
Christian Velasquez.
How about your age, sir?
10.
Salamat, sir, ha? So, Sir Christian Velasquez, unsa man imong gusto na ko itawag sa imo?
Christian.
Okay, so Sir Christian, salamat kaayo. Next is that we need to explain the procedure to the clients and how he can participate during these assessments, and provide the clients the opportunity to clarify, ask, or raise any concern. And explaining the procedure to the clients can reduce clients' anxiety, and it can enhance cooperation and to answer any questions from our clients, and would also help decrease anxiety for this assessment. So, karon Sir Christian, kay i-assess din nato imong thorax and lungs. We're just gonna assess if you have normal findings. So karon na assessment, sir, kay murag ma-expose imuhang upper body or imuhang lawas. Okay lang po ba, sir?
Okay lang.
So naa pa kay pangutana, sir, before doing this procedure?
Wala.
Okay, sir, salamat kaayo, ha. So ang imuhang buhaton lang, sir, kay ituman lang nimo kung unsa akong sulti sa imo, sir, ha. Kay mag-touch lang ko sa imong lawas, sir, okay? We're just gonna auscultate and percuss, sir. Okay lang?
Okay lang.
So, before this procedure, sir, do you have any other questions? Napa kay pangutana, sir? Sige, salamat kaayo, ha? And also, after that, ensure the client's comfort, privacy, and confidentiality, and we also need to make sure that the assessment setting was assured to be safe, secured and free from distractions, and position the client to be seated. This will be providing for the client's privacy, protects the client's integrity, and enhances comforts. Okay. So, sir, since nasuot na nimo ang gown, comfortable ba ka sa gown, sir?
Comfortable.
Sige, so maglingkod ng tagtarong, sir, ha? Okay. Sige, sir, so pwede na ko i-close ang cortina.
Pwede.
I-close na lang po na ko ang door, sir, after ani. Okay lang man, sir, no?
Okay lang.
Para ma-secure na to during the assessment, sir. Nakaipangutan na, sir, before ta mag-start?
Wala.
Okay. Sige, excuse lang po, sir, ha? So now, let us proceed in the working phase. So in this procedure, we need to first survey the chest and respiration of the patient. So first, we need to also check for signs of respiratory distress like nasal flaring, pursed lip breathing, and retractions or problems with oxygenation. Also observe the color of the face, lips, chest, and fingernails of the patients. And do not forget to palpate the suprasternal notch and note the position of the trachea. So, sir, karon kay tan-awan lang nako ang skin color nimo, imuhang nose, lips, ang normalities ug ang imuhang fingernails, sir, kung naabay ano dira, sir. Okay, naba kay question?
Wala.
Okay, itarong lang nako ni sir, ha. So, nag-exercise ba ka, sir?
Wala.
Pero unsa man imong ginabuhat, sir, during summer?
Nagabay.
Ay nagabike ka? Ayo. Isa ka adlaw, sir, pila man ka oras mag-bike?
Isang oras.
Isa ka oras? Sige. Padayon na, sir, og inom og tubig. Sige. So, pag-check na po, sir, imuhang skin color is intact, your skin is intact, and you have kayong manggi imong color, sir, which is normal for Filipinos. Og imuhang nose, sir, pwede pakitaas, tanaw lang sa taas. Okay, normal, sir, walay flaring. Og imuhang lips, sir, is very normal, pinkish og moist. O pwede na ko pakita na sa imuhang fingernails, sir. Okay. So, sige, sir, salamat, sir, ha. O i-check lang na ko diri, sir, na lang ko i-check. Nakay pangunta na, sir.
Wala na.
Isay mo kauban diri pa doon ng hospital.
Ako naman.
Mo naman ka magkatawa, sir. Nasa sa gawas.
Na.
Sige, natanong na to siya. Okay, sir, salamat, sir. Ha, comfortable man ka, no? Naki-question?
Wala na.
Sige, salamat, sir. Okay, so now let us proceed in examining the posterior thorax and lungs of the patient. So under this, we need to first inspect for the configuration. So with this, while the client stands with arms at the sides, we need also to stand behind to the clients and observe the position of his scapulae and the shape of the configuration of the chest wall. So this procedure is to check for the abnormalities or deformities of the patient. So sir, karon sir, kay pwede ka magtindog. Sir, salamat. So karon sir, i-check lang na ko imuhang diri, talikod lang tagamay, sir. Check lang na ko, sir, ha. Okay, diri lang po, sir. Sige, sir, salamat, sir. Pwede na ka mo lingkod balik. Okay, so after that procedure, so we will now be inspecting the spinal alignments for any deformities of the patients. So, from a lateral position, we need to observe the three normal curvatures, the cervical, the thoracic, and the lumbar curvature. So, sir, pwede ka magtindog usab. Tindog lang ka usab, sir, ha? Tugnaw, sir. Natugnawan ka? Wala. I-check lang na po, sir, ha? Ang spine man mo, sir, kay normal. Okay. Sige. Check lang ako yung shoulders. Sige, sir. Ana lang ka, sir, ha? Okay. So after that, I have observed normal findings to the patient because the spine of the patient is vertically aligned. So after that, in like assessing for the lateral deviation of spine or the scoliosis, we need to observe the standing clients from their wear and ask the clients to bend forward and the waist and observe from behind. So, sir, karon sir kay, pwede nimo ipabend ka sir, okay lang? Pwede nimo i-anay mo ang kamot, ibutang nila mo kamot kung form kag X. Sige sir, X lang. Okay? Check lang sa nato usap. Sige sir, pwede ka mag-bend. Bend sir, bend jud sir. Check lang nato. Napay ka bend ana sir? Or kana na kaya? Check lang nato sir ha. Sige sir, taas na sir. Salamat sir, normal man sir. Okay. I-stand lang muna sir ha. So, I have observed normal finding to the patient because his spinal column is straight. The right and the left shoulders and hips are at the same height. So now, we will be palpating the posterior thorax of the patient. So first is that we need to assess the temperature and integrity of all chest skin. And sir, i-check lang na po sir ha. Actually sir, pwede na ka maglingkod. Lingkod din sa sir para dili ka man. I-check lang na po sir ha. I-check man ako imong face how it goes sir. So karon i-check lang ako imong skin diri. Also diri sir, pwede na ko buon. Wala lang sir ha. Natugnawan ka sir.
Wala.
Sige sir, balik lang na to sir. Okay sir, salamat sir. So, from this procedure, I have observed normal findings to the patient because his skin is intact. There was no tenderness. There was no any tenderness. There are no masses. And let's proceed to the next one. So the next part will be palpate all of the thorax areas for bulges, tenderness, or abnormal movements, especially for clients who have respiratory complaints. So, sir, i-check lang na ko dili sir ha usab. Check lang na ko imong chest. Pwede ka mag-ano sir, stand straight. Tugnaw sir. Sige sir, ibalik lang na po sir. Salamat sir. Okay, so from this procedure, I have observed normal findings to the patient because his chest wall is intact. There are no any tenderness or no masses. So after this, we will be proceeding with palpating the posterior thorax for the respiratory excursion or the thoracic expansion. Next is that we will be proceeding in palpating the posterior thorax for the respiratory excursion or the thoracic expansion of the patients. So in this procedure, will be first is that we need to place the palms of both of our hands over the lower thorax with our thumbs adjacent to the spine and our fingers also stretch laterally. Next is that we need to ask the client to take a deep breath while observing the movements of our hands and any lag in movements. So sir, pwede ka mag-atubang dito sir, okay lang? Okay sir, salamat sir. Ayaw ng pagbako sir. Check lang na po sir ha. Can you please adjust the camera? Okay, salamat. So, karon sir kay, pwede ka mag-isbog dire. Sige sir. Karon sir kay, pwede nimo ibutang imuhang hand, right hand dire o left hand dire. Sige sir, kana. Straight lang sir. Check lang na ko ha. Wait lang sir, ihawa lang nako ni sir ha. Ano lang sir. Check lang nako sir ha. Sige sir, pwede ka mag-inhale. Sige sir, inhale jud sir. Inhale pa sir, then exhale. Last sir, inhale plus exhale. Okay, sir, salamat sir. Pwede nang yung maisuot imuhang gown, balik. Atubang na dito sir, salamat. So in this procedure, I have observed normal findings with our patients because he has full and symmetric thorax expansion, just like when the clients or the patients or Christians take a deep breath, my thumb move upwards an equal distance and at the same time, and normally the thumbs should separate 3 to 5 centimeters or 1.2 to 2 inches to be exact during a deep inspiration. So after that, we will be proceeding in palpating the thorax for the vocal tactile or the fremitus and the faintly perceptible vibration felt through the chest wall when the client speaks. So the normal findings for this procedure is that the bilateral symmetry of the focal fremitus should be heard mostly clearly at the apex of the lungs. So in this procedure, first is that we need to place the palmar surfaces of our fingertips or the ulnar aspect of our hands or close fist on the posterior thorax starting near the apex of the lungs, and also ask the clients to repeat such words as blue moon or 1, 2, 3. But in this procedure, we'll be using blue moon. And next is that we need to repeat the first 2 steps, moving your hands sequentially to the base of the lungs and start toward the midline at the level of the left scapula over the apex of the left lung, and move your hands left to right, comparing the findings bilaterally, and also move symmetrically downwards and out to cover the lateral portions of the lungs at the bases. And lastly, we need to compare the fremitus on both lungs and between the apex and the base of each lung. And using either one hand and moving it from one side of the client to the corresponding area, on the other side are using 2 hands that are placed simultaneously on the corresponding areas of each side of the thorax. So, karon sir, i-check lang na ko sir ha. Pwede ka sir, sit o straight o ihubo na ko usap sir. Natugnawan ka sir? Wala man sir no? Or natugnawan ka? Wala. Okay. Sige sir, i-check lang na ko ni sir ha. Karon sir, kay sulti daw og blue moon.
Blue moon.
O sige sir, kailangan na nimo isulti niya sir ha. Sige. Check lang sa nako sir. Kasi mo na feel sir. Kasi mo na feel sir. Sige sir, karon sir kay magsulti na ka blue moon sir ha. Sige sir, sulti daw blue moon.
Blue moon.
Diri sir.
Blue moon.
Kani.
Blue moon.
Kani daw sir.
Blue moon.
Kani.
Blue moon.
Kani.
Blue moon.
Sige sir, salamat sir. So kailangan na mo pwede na mo isuot balik mo ang gown. So in that procedure, I have observed normal findings for our patients. And the normal findings for this procedure is low-pitched voices of males are more readily palpated than higher-pitched voices of females. So after that, we will be percussing the posterior thorax. So in this procedure, first we need to ask the client to bend the head and to fold the arms forward across the chest, because this separates the scapula and exposes more lung tissue to percussion. So now, percuss it in the intercostal spaces at about 5 centimeters or 2 inches to be in sac intervals in a systematic sequence. And also next, compare one side of the lung with the other. And lastly, percuss the lateral thorax every few inches starting at the axilla and working down to the 8th rib. So, karon sir, kay ihubo na pud nako sir ha. Naa kay pangutan na sir.
Wala.
Gitug na wala.
Wala.
Pwede ta mag sit lang properly sir. Amat. Sige sir, buon ako sir ha. Na kay pangutan na sir.
Wala.
Sige sir. I-check lang nako sir ha. Pwede nimo i-ana imuhang ikatong butang nimo diri imong kamot sir. O i-bend lang imuhang ulo sir please. Ana lang sir ha, sakit dili man naglisod.
Dili.
Wala. Sige sir, mag-start na ko sir ha. Okay, sir, salamat sir. Sige na sir, pwede na may tasin mong ano. Isuot lang na kayo mong gown sir ha. Okay, salamat sir. So in that procedure, again, I have noticed normal findings for Christian. So the normal findings of this procedure, that is percussion sounds on the posterior thorax. There are percussion sounds. So next is that we need to measure the diaphragm, the diaphragmatic excursion rather. So in this procedure, first is that we need to use a percussion to identify the level of the diaphragm and measure the diaphragmatic excursion with this. Percuss downwards from above the expected level of the diaphragmatic dullness until the dullness is heard. And next, mark the level of full expiration after gaining the patient's permission for the marking. And also, have the patient inhale deeply and hold it in, then percuss downwards to the level of the dullness and full inspiration and mark it. Next is that repeat this process on the other side and measure the distance between the expiratory and inspiratory levels of dullness. Okay sir, so karon sir kay pwede ka magtindog sir. Nalang ko i-check sir ha. Dili lang ka sir. Adjust lang. Karon sir kay magamit na ko marker sir ba? Then niya i-mark lang na ko gamay pero dili man kayo siya huga. Okay lang. Sugot ka sir. Okay sir. So muling ko tayo itabalik sir. Sorry kaayo. Musugot man ka sir no naabot nga lang ako markings para ma-identify lang nako. O sige, salamat sir. So karon sir kay i-wait lang i-percuss lang nako sir. O I'm going to ask you sir na you should take your breath deep sir ha. Inhale and exhale. O kung answer ka na iana lang imo-imohang ano. Ana. Sige sir. Ayos lang tayo sir. So before this sir, napakay pangutana.
Wala lang.
Sige, bow down ng gamay. Sige sir, mag-start na ko sir ha. Wait lang, sorry kaya sir, ubo dahil yun sir. Start na ko sir. Sige sir, mag-deep breath lang sir ha. Sige sir. Sige sir, sub daw sir. Okay sir, diri na ta sir. Pwede ka mag-bend lang ba na? Kani sir. Ano lang sir, inhale, tapos exhale. sulatan lang ako sir ha. Pero washable man ni siya na marker sir, pwede lang may maano. Sige sir. Okay na sir, sige na sir, pwede na. Naalang ko i-measure sir ha, kadali lang sir. Okay. Sige sir, salamat kaayo sir ha. Karon sir kay pwede na niya mo paano mo hang gaon. So next is that we need to proceed in auscultating for the breathless sounds. So the first thing that we need to do is that we need to place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7. This is because the diaphragm of the stethoscope is best for transmitting the high-pitched breath sounds. And next, ask the client to breathe deeply through the mouth for each area of auscultation or each placement of the stethoscope. So using the systematic ladder pattern used in percussion, we need to listen at each point to the breath sounds during a complete inspiration and expiration. Lastly, we also need to compare the findings at each point with the corresponding points on the opposite side of the thorax and note the location on the chest wall where adventitious sounds are heard as well as the location of such sounds within the respiratory cycle. So, karon sir kay lingkod ng sir ha, taro. Kay hubo ipa-expose na ko ning diri na part ni mo sir hubo na ko ni ha. O karon sir kay magamit na jud ta ani sir, kabalo ka ani. Nakagamit na ba ka ani? This is called stethoscope, sir. So, mao ni ang diaphragm. Okay, butang lang ako diri sa imo ha, sir ha. O I will also ask you to take a deep breath, sir ha. Inhale o exhale, sir. And also, sir, kana kung mag-breath ka, sir, kay sa mouth ka mag-breath, sir, kanang rag-ani, oh. Okay lang, so try daw. Okay, sige, sir. Sige. Mag-start na ako, sir ha. Okay lang. Sige sir, sa mag-ano lang ta sir, hubo lang ta. Sige sir, pag-place na ko diri sa diaphragm sa stethoscope diri sa imo ang respective area, kay mag-inhale ug exhale lang ka sir ha. Sige sir, mag-start na ta sir. Before ta mag-start, do you have any other questions?
Wala.
Sige, salamat. Mag-start na ko sir. Pag inhale ug exhale, sir, gamit imong mouth, please. Sige, sir, salamat. Dirita na ta. Sige. Diri na po ta, sir. Sige, sir, dirita, sir. Last na ni, sir. Sir, salamat sir. So, ibubo lang sana ko ni sir ha. Gutang na ko dire. Okay. So, during that procedure, again, I have noticed or I have found normal findings for Christian. So, the normal findings for this procedure is that the vesicular and bronchovesicular breath sounds should be heard during that procedure. And also, after that, we need to proceed in auscultating the voice sounds. So, in this procedure, we need to follow the same procedure that we have done in auscultating for breath sounds. So, sir, karon sir, kay atubang lang dito, sir, okay lang. Sige, salamat, Christian. So, karon sir, kay expose na nato gamay imong likod, sir. Natugnawan na ba ka? Wala. Sige. Okay lang ihubo, sir. Sige, sir, ispog lang tagamay, sir. Karon kay magamit na pud kong stethoscope, sir, ha? O unya ay sir, kay after ani na procedure kay during this procedure pala, sir, kay I want you to say 99, ana, sir, ha? O letter E for echo. But before that, sir, I just have to check this one. Sige, sir. Check lang ako, sir, ha? Okay, sir. Salamat kaayo, sir. Stay still lang, sir. Okay. So, after that, in bronchopony rather, we need to ask the client to repeat the phrase 99 while auscultating the chest wall. So, karon sir kay, mao na niya akong ginamin na 99 sir ha. So, can you please say 99 sir?
99.
Sige pa daw sir.
99.
99, okay. Sige sir ha, wait lang sir. I just have to check this one. Sige sir, try saying 99.
99.
There is
99. 99.
Okay sir, salamat kaayo sir. And after that, in egophony, we need to ask the client to in agaphony, we need to ask the client to repeat the letter E or echo while listening over the chest wall. So after that, sir, kay letter E na po di mo ibangkit, sir, ha? Can you please try saying E, sir? E.
E.
Ah, sige, salamat, sir. Sige daw, sir. E daw, sir.
E. 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 E.
Okay.
E. E.
Ah, sige, salamat kayo, sir, ha? Okay lang ka?
Okay lang.
Na kay questions?
Wala.
Okay, let's proceed to the third one, sir. So, let us proceed now in whispered pectoriloquy. And in this, we need to ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall again. So, karon sir, kay I just need you to whisper the phrase 1, 2, 3, sir. Can you try that for me?
1, 2, 3.
Whisper lang po, sir, yan.
1, 2, 3.
Sige, can you try in a silent whisper lang, sir? Oh, sige, better, sir, better. Sige, let's start, sir, ha? Okay. Sige, sir, try whispering na, sir. How about this one, sir? Kani, sir? Okay, Sir Christian, salamat kaayo, sir, ha? So, ang next procedure, sir, mag-start na ta. So, before proceeding with the next procedure, sir, do you have any other questions?
Wala.
Wala. Sige, sir, atubang lang dito, sir. Natugnawan na ba, sir?
Wala.
Sige. So, after that, now, we will be proceeding in assessing the anterior thorax. And from this, first, we need to inspect for the breathing patterns like respiratory rates and rhythm. So, karon sir, kay higda na jud ta, sir, ha? Gusto na ba ka higda?
Gusto.
O, i-check lang na ko ni imo ang anterior thorax while you're lying in the bed. I-check lang po na ko ang rhythm o ang respiration nimo, okay? Sige, sir, balhin ta sa bed, sir, okay? Sige, sir, tindog lang ta. Okay, so Christian, di ba naa naman ta sa bed karon? Comfortable ba imo ang pag lay down?
Comfortable.
Comfortable man, no? Sige sir, kanang pwede na ko i-expose imo ang anterior part. Okay lang?
Okay lang.
Sige sir ha, tugnaw.
Dili.
Dili ba, no? Sige sir. Check lang ako ha imong rhythm of respiration. Sige lang sir. Effortless man, sir. Sige. Sige, sir. Ibalik lang sa anak ko, sir, ha? So, again, in this procedure, I have observed normal findings with Christian. And the normal findings for this procedure will be quiet rhythm and effortless respiration, as I have aforementioned a while ago to Christian also. So, next is that we need to inspect the costal angle, and this is the angle formed by the intersection of our of the costal margins and then inspect for the angle at which the ribs enter the spine. So sir, karon sir kay i-check lang nako ang degree sa imong costal angle. Tugnaw sir.
Dili.
Sige lang sir, wala man kay buhaton. Try daw inhale o exhale sir. Sige sir, balik lang sa nato. Salamat sir. Okay. So, again, in this procedure, I have observed normal findings for patient Christian. So, the normal findings is costal angle is less than 90 degrees and the ribs inserts into the spine at 45 degrees. So, the next procedure is that we need to proceed in palpating the anterior thorax, and this is to check for the tenderness, sensation, surface, masses, crepitus, fremitus, and etc. And using our fingers to palpate for the tenderness and sensation, we need to start palpating with our hands positioned over the left clavicle or over the apex of the left lung, and move your hands left to the right, comparing the findings bilaterally. And next is that we need to move our hands systematically also downward toward the midline at the level of the breast, and then outward at the base to include the lateral aspect. Next is that we need to repeat the sequence in palpating for the crepitus and fremitus in the anterior. So, sir, kay pwede ka mag-straight ng i-expose na ko imong skin sir ha. Magpakibutang ng imong paandere. So, naka-remember ka atong nag-99 ka sir, nagsulti kag 99. Sige sir, pwede nimo isulti na karon sir. 99.
99.
Sige, kana 99 sir, kay magamit na unya, okay? Okay, so mag-start na ta sir. Na lang ko i-check. Sir, so can you please say 99?
99. 99. 99.
Gina-check lang na po ang vibration, sir. Sige, sir, continue.
99. 99. 99. 99.
Okay. Sige, sir. Salamat, sir, ha? So, in the next procedure, we need to proceed in palpating the anterior thorax for the respiratory excursion. So first, we need to place the palms of both of our hands on the lower thorax and with our fingers laterally along the lower rib cage and our thumbs along the costal margins. And next is that ask the client to take a deep breath while you observe the movements of your hands. Okay, sir. So, karon mag-start na ta sa procedure, ha? Karon kay i-expose lang na pa imong lawas, Sir Christian, ha? Nakay pangapangutan na, sir.
Wala na.
Okay, mag-start na ko, sir, ha? By the way, sir, sa karon na procedure kay I'm going to ask you to take a deep breath, sir, ha? Sige, sir. Take a deep breath daw, sir. Sige, sir. Exhale. Sige pa daw, sir. Sige, sir. Inhale, sir. Then exhale. Sige, sir. Salamat, sir. So, let's proceed to the next procedure, sir. Do you have any other questions?
Wala.
Okay. So, during that procedure, I have observed normal findings for patient Christian. So, the normal findings are patient Christian has full symmetric excursion, And the thumbs are normally separated 3 to 5 centimeter. And now, we will be proceeding in percussing the anterior thorax systematically. And in this procedure, we need to begin percussing above the clavicles here in the supraclavicular space and proceed downward to the diaphragm and compare the lung on one side to the lung on the other side. So since we don't have an hospital bed, I'm just lying down here also to adjust. So to improvise, we're going to elevate this one by using another pillow. So Sir Christian, pwede ka magtindog lang ka diyot? Sige sir. Sige sir, ato bang dito? So, in this procedure, let us start. Okay, sir. So, dili na ta magsugod sa pikas. Sir, salamat sir. Okay. So the next step will be, oh by the way, in this before that procedure, I have observed normal findings to the patient. So patient Christian, his percussion notes resonate down to the sixth rib at the level of the diaphragm, but they are not flat over areas of heavy muscles and bone. Done on areas over the heart and the liver, and also the tympanic over the underlying. So now, we will be proceeding in auscultating for the anterior breath sounds, and also for auscultating for the adventitious breath sounds and the voice sounds. So in this procedure, first is that we need to auscultate the trachea, and the normal findings for this is that the bronchial and tubular breath sounds should be heard. Second is that we need to auscultate the anterior thorax by placing the diaphragm of the stethoscope firmly and directly on the anterior chest wall. And also we need to auscultate from the apices of the lungs slightly above the clavicles to the bases of the lungs at the sixth rib, and follow the sequence for the anterior chest auscultation. And next, ask the client to take breathe deeply through the mouth to avoid transmission of sounds that may occur with the nasal breathing. So, karon sir, kay mag-start na sa ato ang procedure. So, do you have any other questions, sir?
Wala na.
Sige. So, karon sir, kay mag-use ta og stethoscope, sir, ha? So, pwede na ko i-expose si mohang body, sir. O, ibutang na yung kamot din, eh. Okay. So, habang gina-place na ko ng diaphragm sa mohang skin, sir, kay I want you to inhale and exhale, sir, ha? So that I can detect the vibrations in your body, sir, okay? Okay. Mag-start na ko, sir, ha? Sige, sir. Sige. Inhale lang, sir. Diri, sir. Diri, sir. Diri, sir. Diri, sir. How about diri, sir? Diri, sir. Diri. Sige, sir. Salamat kaayo, sir, ha? O, karon sir, ibalik na nato ni. And let's proceed with the next procedure. So, in the next procedure, lastly, listen at each side for at least one complete respiratory cycle, and also listen for normal breath sounds and adventitious breath sounds, and follow the systematic ladder pattern. So, karon sir, mag-use ko usab og stethoscope. O pwede nimo pakibaba ang hapon, sir. Sige, sir, salamat. So, mag-start ako, sir, ha? Okay, sir. So, karon I want you to say the word blue moon, sir, ha, while I place this diaphragm, sir, on your skin, okay? Sige, sir. Sample daw, sir. Blue moon.
Blue moon.
Okay, salamat, sir. So, sige, sir.
Blue moon. 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 Blue moon.
Sige, sir. Salamat kaayo, sir. So, the normal findings of this patient, I believe in that procedure, I have observed normal findings for patient Christian, which will be bronchovesicular and vesicular breath sounds were definitely heard. So, I believe that that will be our very last procedure in this assessments or assessments for thorax and lungs. So, lastly, we'll be proceeding in the summary and the closing phase. So, in this procedure, we will be summarizing the information obtained during the working phase, and also discuss the findings to the clients, and discuss to the client the possible plans to resolve health concern if present. This is to inform the clients about the next assessments. Next, assess the client's understanding of the plan and the need for further teaching, and provide the client the opportunity to clarify, ask, or raise any concern. And also thank the clients and ended the interview politely. Done after care, perform hand washing. This is to deter the spread of microorganism. And lastly, we need to document the findings in the client's record using printed or electronic forms, or checklists supplemented by the narrative notes when appropriate. So, karon sir, kay human naman ta sa ato ang assessment sa thorax and lungs. Thank you kaayo sir sa imuhang cooperation, sir, ha. So, before I will discuss the normal findings, sir, do you have any other questions? Sige. So, while I have inspected the spinal alignment for the deformity, sir, a while ago, I have inspected normal findings, sir, which is a good sign. So, the normal findings, sir, is that your spine were vertically aligned, the spinal column is straight, and the left shoulders and hips are at the same height. Ang pasabot ana, sir, kay ang spine nimo kay spinal column nimo kay straight, ang spine nimo kay vertically aligned, wala ko nakita any abnormal findings, sir, okay? So, the next part will be the palpating the posterior thorax. I have also inspected, sir, normal findings to you. That your chest wall, sir, is intact. The bulges, no tenderness, sir, no masses. And also the skin, sir, is intact, no tenderness, and also no masses. So, sa thorax for vocal, sir, for the tactile, you have bilateral symmetry of vocal fremitus that is heard. And also, you have low-pitched voices of males are more readily palpated than higher-pitched voices. So, before I end this assessment, sir, I just want to advise na please exercise lang jud, sir. Ipadayon to imuhang pag-bike-bike, sir. Increase tong hours sa imuhang pag-bike-bike. O please make sure, sir, na ang dalan sa imuhang bike kay safe, sir, ha, okay? So, also, sir, drink water, sir. Please drink water 8 glasses, at least 8 glasses a day, sir, ha? Katulugon naman ka, sir, no? Sige, sir, uman naman punta. O karon, sir, sleep early, sir, ha? So, since it's already 8 p.m., sir, matulog na ka, ha? O, also, sir, avoid smoking, sir. So, since you are a child, ayaw dyan pagkuan, sir, ha? Katulugan na ka, sir? Sige, sir. Mauman naman ta. Ayaw sa. Sige, mauman naman ta, sir. Sige, sir. Sorry kaayo, sir. Sige. So, maunang tutanan, sir. Salamat kaayo sa imong cooperation, sir, ha? O, walati lang imong mama diri, sir, ha? O, after this, sir, do you have any other questions? Wala? Sige, sir. Salamat kaayo, sir, ha? O, mag-hand washing lang ko. O, comfortable ba ka, sir? I-adjust ba na to ang aircon? Para makatulog ka, sir. Sige, sir. Adjust lang na po, sir. Comfortable ka or gusto ba nimo okay lang na imong kaan ulo dili. Sige. Salamat kaayo, sir, ha. And also, sir, I have documented your findings here. Ayaw sa sir niya na. And also, sir, I have documented your findings here. And this will be secured, sir. Ang mga nurses lang makitaan niyo ang imong doctor, sir, ha. Okay? So I believe, sir, this is the I have to say goodbye na. Thank you again, sir. I'm your nurse, Kenneth. And thank you, sir. Okay? Okay. So that will be all, guys. Thank you very much.